I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd like to call the Lamar City Council regular meeting for Tuesday, August 20 to order. Roll call, please.
Goodchild.
Yes.
Witt. Sturgeon.
Yes.
Bruns.
Here.
Pick.
Here. Motion to approve the agenda.
Second. We have a motion and a second. All those in favor say aye.
Aye.
Opposed?
Aye.
Nope, remember you got a delay.
Yeah.
I'm not
The
opposed.
agenda passes. Moving on to general discussion. Citizens, any citizens here to address the council? Nobody jumping up? We'll move on to the thumbs up award. Brad,
I don't have anything today.
Ryan,
Pass.
Clark.
Change it to a hats off for Dr. John Conley.
Oh,
Long time citizen, passed away, and very, very large contributor to this community, so, Dr. John.
I will echo that and also give a thumbs up to the new location and kind of semi-successful so far farmers market that's moved downtown. It seems to be going well and is very well received, so I'm excited about that. So I think Rob Scheitler is behind that, so thumbs up to him. So. Mark Sturgeon, you have anything?
No, sir.
Okay. Moving on to consent items. Under the consent items, we have an approval of the August 6, 2024 regular meeting minutes, a list of bills for period ending 8/16/24, monthly financial statement for July of 24, a temporary premise transfer for liquor license to KT's, an amendment of an outdoor service area to Wise Eye, and a new 5-day liquor license to Willow Creek, and a request to close the street from Wise Eye as well.
Motion to approve consent 1 through 5.
Second. I have a motion and a second. Any further discussion on those items? All those in favor say aye.
Aye.
Opposed? Motion carried. Moving on to action items. First on the action item is a Floyd Valley Healthcare purchase agreement. Floyd Valley Healthcare would like to purchase approximately 6,519 square feet of the 10,000 square foot strip center that will be constructed on lots 3 and 4 of Highway 75 Business Park. This space will house Floyd Valley Urgent Care and Floyd Valley Home Health. Construction will begin immediately, with the shell being completed approximately October 15, 2024. Administration recommends the council approve the purchase agreement presented. Financial implications are the total purchase price for the 6,519 square feet will be $1,302,431, funded by Floyd Valley Healthcare.
Thanks, Dustin. Just, will this be an addition to existing urgent care, or will this be the only urgent care home health?
That will be the only one. Urgent care will move out of the hospital into that space.
Okay.
And home health will move out of the basement to that space also. So both projects we think are going to be really an ease of access point into the community that we don't offer right now. And we've heard feedback in the community on both of those items.
Thank you.
What will the hours be for urgent care?
Urgent care Monday through Thursday is 8 a.m. to 8 p.m., Friday 8 a.m. to 5, Saturday 8 to noon, Sunday from 1 to 5.
So do you currently need this space that you're freeing up?
Yeah, the urgent care space will be part of right now where we hold our specialty clinic practices. So for future family medicine growth and specialty practices, that'll free up space internally. And then the home health department in the basement will be for future growth opportunities as well.
I think it's a great location for it.
Yeah, and really the urgent care model, thanks Mayor for the reading on that, it's going to represent a more true urgent care of what you would see versus in the hospital. The entry point really isn't the most ideal, and having that front-facing location is something we're really excited about.
So what's the total cost on this? Because this is just a shell only.
Yep, so we'll have to have a bid out on the internal piece of it, and that part we don't know yet, Clark.
Well, you have to have some idea.
Yeah, potentially in the $150 to $200 a square foot for the build out, but we'll see how those bids come back.
I feel a little bit completely caught off guard on this, which I really don't appreciate. Had no clue it was in the works. I don't know if it was in the works since February. But I know that it seems to me like we gave this developer on a 4-to-1 vote, $250,000 because he couldn't proceed with this professional building without that money. Turns right around and buys another lot with it, or at least buys the adjoining lot. So basically we gave him the lot at a very elevated price. And then this gets brought to me. We have a convention center that's only half used an eighth of the time. There's a space that we already own. We want a fire station down in this area. Something like this could probably be tied into a complex there. We're taking this off the tax rolls. We're taking this, so now this commercial space that we've given a 5-year tax credit to, now we're taking it off the rolls completely because you're non-taxable. Very hesitant, I'm sorry. I'm not saying it's not a good idea. I'm not saying it's not even maybe warranted in the future. I've gotten a lot of feedback from community people saying, what the hell are you guys doing? So I gotta be honest with you, the people that I represent, I'm not in favor of this, especially as it is. And I won't even go into what I feel is a one-sided purchase contract favoring the seller. I've got marks all over, but I'm not gonna waste everybody's time. So those are just my comments. Anybody else can jump right on in.
I kind of agree. I think that $1.3 million for just the shell is a lot. I mean, when the LBIC owned it, if the hospital had bought the lots and built their own shell, it would have been a lot cheaper.
Yeah, I couldn't agree more.
Anybody else have any comments? Mark or Brad?
I just say I see that Clark and Brian's points are pretty valid.
I guess Mayor and Council, I can add in from the project itself, how that came forward. When we knew that that space was actually going to get developed, then we were interested in it. So actually having the opportunity to purchase that space, build out, all of those things would go through a public bid. So I feel like it's a competitive number from the shell standpoint of what we've seen and working with the architects on what a project like that is going to run. And for us to go out and find a new space, which we could, by then you're purchasing the lot. I think it's in a perfect, ideal location in the community, and that was our sole point of trying to be at that central part of where it's at. So that honestly is how it came
I wish I would have known a little bit more
forward.
up ahead. I really wish I would have known a little bit more, because to get this dropped on me last Thursday is somewhat unfair. Then I read about it on Clem. So I feel like, to tell you the truth, I'm not representing the very people that I am here to represent. And this would be adding a problem, or adding even more onto what we've already done. So I'm sorry, Dustin, I back the hospital. I love the hospital. You do a fantastic job. I know that all goes in one ear and out the other when I'm but I'm not getting behind this at this stage. So that's where I'm at.
Mark, you want to shed some light on how
Yeah,
this
so
all
when we
came
made the
about?
request in February for the TIF assistance for this project, that was not part of it at that time. I can assure you of that.
Okay.
They came along afterwards.
Okay.
And just as a reminder, the reason for the TIF request is because there's probably a third of that lot that's not usable, and we were trying to mitigate some of the risk. But in return, we got a $1.3 million minimum assessment agreement, which would return those taxes to the citizens in a matter of less than 6 years. In the world that I come from, a 5-year payback on property taxes for a project such as this is pretty darn good. And so once this came along, we did have that conversation with both Dustin and the developer that the reason the TIF was given is because we knew we would receive those taxes back, and after the 5 years, then you continue to receive those taxes as long as the building's there. And so the solution to that was Dave bought that additional lot and is gonna put up an additional building. When he originally purchased that additional lot, that wasn't gonna be part of the initial project. That would come as a second phase. Now, we would like to take that additional lot, put up the building so we can continue with the $1.3 million minimum assessment. We improve the healthcare situation in Lamar's, Iowa, and we still achieve the $1.3 million minimum assessment of property taxes over time. And it gives the health system a convenient location for urgent care. I haven't received a call since Thursday when you got your packet. You certainly could have had this conversation anytime between last Thursday and now. So,
Yeah, I could have, but it's given me 4 days to digest all this and take community comments, Mark. That doesn't fly. And back to the whole TIF, once again, at budget time, we see an overloaded general budget because it's picking up all of the TIF areas, and that's a burden on our streets, police, fire, everybody, because the TIF is a burden to the general. And it's to be used in a very good way. I'm not even, but you brought up, we're improving the health care of Lamar's. I'm not a physician, I'm not an expert,
It's
but I will
convenience.
say, what is Lamar's lacking right now in healthcare? What is Lamar's lacking right now in healthcare?
I'll have to let Dustin address that, but tax increment financing is using the new taxes generated from the project. The existing taxes that are generated from that piece of ground are still generated at the same rate. Those new taxes don't go to the general fund until we release that TIF district. So regardless, though, that project, by not happening, isn't gonna help or hurt your general budget. We created a TIF district to utilize the new taxes in order to help fund either infrastructure or a portion of the project. Those are new taxes, not existing taxes. The existing taxes are still utilized the way they currently are. We capture the new taxes to help finance.
I have a question.
Yes.
Go ahead,
So,
Mike.
I know the contract mentions that time is of the essence. What's the harm specifically if we table this till the next council meeting? We'll have 5 council members present, we'll have more time to have discussion.
Yeah, that was one of my earmarked, thanks, Mark, because that was one of my earmarked, was time is of the essence in this purchase contract. Is there,
Dustin, does that slow you down? or-
I think time is of the essence is just standard language in a purchase agreement, so I don't see
Okay.
that there would be any harm if you did decide to delay till the next council meeting. I think time is of the essence is pretty typical in a purchase agreement.
I would agree. I would also suggest that if there is a motion to table this action item, we should also table the next action item, because they go hand in hand.
I see that.
Exactly.
I see that.
And I don't.
That was gonna be my
if
point.
that's okay with these guys, and maybe that's what we should do to get your questions answered before we have a vote, and hopefully we'll have all 5 councilmen here for the vote. It's-
And I will also just.
So this is Mark.
Yep, go ahead. I'm sorry.
I would like to make that motion to table both D1 and D2 to the next council meeting.
I second that.
Okay, we have a motion and a second. Any further discussion on that?
You have to do it separate.
I don't think so.
Mayor and council, can I just add one item? It is never our approach to try to catch anyone off guard with what we do with our community health care. So I apologize profusely if that was the interpretation of what happened here. That is by no means what we want to have happen. Happy to answer questions. The Clem interview was a reach out, and it said at that point in time, which I have always said for any type of news release, is that nothing is final until it goes to city council for approval. So outside of just blatantly ignoring the outlets, I am very direct about that.
And Dustin, I couldn't agree more, and I know you're that way. Given the addition to the new birthing center, I had a private meeting with you because I didn't understand it. You invited, that's where I'm scratching my head on this. This is a lot of money to me to just, okay, let's go with this. So, to be honest, I totally believe you, but understand my position. I didn't see this coming.
So how are you funding the purchase price?
Cash reserves at Floyd Valley. Yep.
I want to go back to the purchase of that property to begin with. I think it is important to note that property, the unusable nature of part of that property. I think for that property to be developed, I think it was important for the city council to take some sort of an action to incent a purchase on it, because I'm not sure, I don't know, and maybe Mark can help answer this, I don't know what it would have brought had we not taken some sort of action to provide that relief, if you want to call it that. So, so I think that's an important thing I wanted to point out. I think that's part of the reason. Generally speaking, I'm not necessarily always going to be in favor of, TIF money up front, like what we did with it. But in this instance, because of the nature of that property, I think it was an exception that was worth doing that for. So, that has to do just with simply with the TIF part of the purchase of that property, and not necessarily to do with this. But I agree with Mark on the payback on this, and I think it's probably having used urgent care, I can tell you it's not the most convenient setup. The way it's structured now, I mean, it's a maze to try and get back to it. So, I dropped breadcrumbs the last time I was there.
But going back to this particular lot, and I'm not even necessarily disagreeing with anything you're saying, Brad. I'm a little uncomfortable with it, but when the project was first brought to us, I thought they had irons in the fire to fill that in. I don't know if it was attorneys or real estates or insurances or whoever to fill it. We were just going to put up an empty shell and hope for the best. Okay, well that wasn't, I guess.
I would, my recollection was similar to what you were talking about, Clark, but now maybe that's a misinterpretation
You're right,
on my own part,
right.
I don't know.
I've consistently got a flow of people looking for space. Couldn't talk about this particular space because there was no project there. But if this were to happen, this is the type of thing that can happen. You can't rent out a space until you have the space to rent out and people understand what it is. So did we have people interested in locating in Lamar's at that time? Certainly. Were they committed to this project? Absolutely not. We own a piece of ground. We're working to develop it to potentially put a strip center. Simple as that.
A piece of ground that has sat vacant for 50 to 75 years.
Absolutely, and it's never
Something
been.
like that, and never been developed. We've already got all the infrastructure there. We've got all the, we paid to have all the infrastructure there. It's time to get something there.
Yeah, again, I think the incentive was justified to get it moving forward.
But
for sure.
but whether it's the hospital project or not, I thought the incentive was to put a building up, and so that
Correct.
should continue anyway. That should be marching forward tomorrow anyway.
And I
Well,
believe,
they're actually moving there today already, so.
Okay.
And I've kind of said it to Dustin and Daryl as well in our past discussions. Whether they're in or they're out, we're still building the building, we're
Okay.
committed to it. We've done the same thing in Orange City, Rock Valley, just different communities. And, you know, it starts with a little bit of interest, and it definitely wasn't Floyd Valley Hospital's interest that made us start thinking about the project. There was somebody else at the table that had some interest. But like Mark said, no commitment. As a developer, you kind of take that risk and hopefully put up a good-looking building that will attract some potential tenants. And so, yeah, we were gonna, and we still are moving forward.
Okay.
Obviously, we're moving dirt. So-
And you've got about a third of this, if this goes forward, you've got about a third of the building left and you have interest in that. Again, no commitment, but some interest.
Yep, correct.
Or more.
And then, you know, I did purchase that front lot, lot number 5, mostly because I felt like it's a really good egress and egress and ingress in and out of our property. I think coming from the old Highway 75 and for signage, and that's why we purchased lot number 5, knowing we could potentially get a building there too. And I've had several inquiries about other space, no commitments, but we didn't ask for the additional TIF on lot 5. We're very pleased with lot 3 and 4. And as it was talked about, it's really that draw that's in the back. Quite honestly, if we didn't get the TIF, I probably really wouldn't have been interested in that kind of money for that lot and that amount of square footage.
And there is already a lot on, or a building on lot 1, so that's generating revenue as well.
I
Yeah,
think I'm
one
gonna
comment for
talk-
Dustin, though.
I'm gonna talk to Joe privately sometime in the next 2 weeks, because I wanna get my head around TIF. I have a basic concept, I think, but it really bothers me every budget season, so I don't think I have a full concept of it. I'll be the first to admit it, so.
I don't want to stop the discussion, but we do have a motion and a second.
Yeah. Mark had a comment.
Yeah. Yeah,